Now this is the most important part that you need to understand when we are talking about the mechanism of action of TENS. And why I have zoomed it a little bit so that you can see the diagram and you can understand. See, this is very important to understand, because if you wish to get the intended effects of the stimulation or application of TENS, you have to understand this particular theory, right? So we are going to discuss. We said that there are three modes that the TENS, in which way the TENS causes pain relief, right? The first is segmental. What happens? The first is peripheral. So what happens is peripheral. The pain, the tissue damage is over here, and the sensation of pain are going towards CNS through the spinal cord and towards the CNS, right? And when you apply TENS over here, so what does the TENS do? It causes a antidromic effect. What do we mean by antidromic? From the point of stimulation, current follows in both the directions. This is known as antidromic, right? So it causes an antidromic collision. So here the pain is getting produced and the sensations are going towards the spinal cord, and here antidromically the stimulation of TENS is causing a collision over here, thereby disturbing the input of pain right from here. So this is the first mechanism which is locally acting, or which we can call it as a peripheral mechanism, through which the TENS releases pain. Again, at the point of stimulation, from the point of stimulation, it antidromically means it goes reverse in the direction of the damaged part, and it kills or it collides with the sensations coming from the damaged part, thereby reducing the frequency of pain sensations right over here. This is the first mechanism, that is known as the peripheral mechanism. The second mechanism is the segmental mechanism. Now when we talk about segmental, we are talking about the spinal cord induced mechanism, right? So what is the segmental mechanism? There is a part of damage over here which is creating pain, and this pain is being taken to the spinal cord through the A, delta and C fibers, right? So when we cause a stimulation of TENS over here, we stimulate the A beta, right? We stimulate the A beta fiber here, so it carries sensation faster than the A, delta and C sensations, right? So normally when A, delta and C take the sensation towards the spinal cord, they stimulate the substantia gelatinosa, thereby influencing the T cells, and then the T cells send the information of pain to the higher center or to the brain through the spinothalamic tract and the spino-reticular tract, right? So this is a normal mechanism, that whenever you have a tissue damage, the pain is carried by A, delta and C fibers to the spinal cord, from the spinal cord through the substantia gelatinosa, and stimulation of T cells, the pain is sensation is transferred to the higher centers by spinothalamic tract and spino-reticular tract, right? So what we do over here, that when we are stimulating it with the A beta fibers, so A beta fibers are sending the stimulus from here to the brain, that this is paresthesia. Understand that it causes a rubbing sensation, and these sensations are carried faster than the A, delta and C sensations. You have to remember this when we are talking over here, right? So the sensation from these are carried faster, and they get transferred directly to the brain, saying that it is not pain, it is paresthesia. This also causes release of GABA in the spinal cord, and what GABA does is it inhibits the substantia gelatinosa. So this whole cascade is getting inhibited, right? This is getting inhibited at the segmental level, okay? So again we have to understand that the first level was the peripheral level, where here I am having an injury and the pain sensation is going over here. I am applying TENS over here, right? So TENS is beating the pain sensation, and here the pain sensation is coming, here the TENS is going, so it is colliding over here and it is reducing the sensation over here itself. This is known as the peripheral mechanism. The segmental mechanism, from here the pain is going to my spinal cord, right? And in my spinal cord it goes to the substantia gelatinosa, where it causes stimulation of the T cells, and T cells thereby transfer the information to my higher centers, right? Now what I am doing is, if I am applying TENS over here, this TENS application over here is causing faster conveyance of stimulation of beta fibers. So this is getting transmitted from my spinal cord faster and giving my brain an intention that this is just a rubbing or this is just a soothing paresthesia that is occurring over here. There is no pain over here. So the brain stops identifying, it starts releasing GABA, and GABA inhibits the substantia gelatinosa, and thereby the transmission of the pain sensation from the substantia gelatinosa to T cells is also gets inhibited. This is known as the segmental mechanism. The third mechanism is the extrasegmental mechanism. Let us see it also. Okay, let us understand the extrasegmental mechanism. And the extrasegmental mechanism includes this particular thing, right? What happens in the extrasegmental mechanism? Normally, if there is pain, the pain is traveled through A delta C fiber to the substantia gelatinosa. From there, it is going to the nociceptor, central nociceptor transmission cells, that are the T cells, and from there it is going to the brain and identified as pain. So when we apply TENS over here, so we are talking about the TENS over here, right? Because that is having the extrasegmental effect. So when we apply the TENS or the burst TENS over here, it causes a stimulation of A beta, A delta and G3 fibers. G3 fibers are the muscle nociceptor fibers that receive the information from the twitch that is occurring in the muscle. So here the mechanism is pain, and it is taking the pain sensation over here. But because this works faster than the A delta, so this takes the mechanism of muscle twitch and paresthesia through the brain. Once the brain realizes that there is no pain but there is muscle twitch and paresthesia, the brain initiates the descending inhibitory mechanism. It is the descending inhibitory mechanism by stimulation of periaqueductal gray and the nucleus raphe magnus, right? So there are certain gigantocellular nucleus is also there, and raphe magnus nucleus is also there. So the descending mechanism stimulates the periaqueductal gray and these thereby stimulate the MET enkephalin in the spinal cord, which inhibits the activity of substantia gelatinosa. Again, normally when the pain occurs, the pain is transmitted to the substantia gelatinosa. From there it is transmitted to the central nociceptor transmission cells, that is the T cells. From there it is going to the brain. When we are applying TENS over here, TENS is causing a stimulation of it is causing a muscle twitch over here and a sensory stimulation over here, which is transmitted to the brain as muscle twitch and paresthesia. As these are faster transmitting neurons, so the brain identifies not the pain, but it starts identifying the muscle twitch and paresthesia over here, right? So this activates the descending inhibitory mechanism, thereby stimulating the periaqueductal gray and the nucleus raphe magnus, which are the descending nuclei, and they start release of the MET enkephalin in the spinal cord, which thereby inhibits the substantia gelatinosa, thereby inhibiting the pain sensation, right, at 3 level. So this is the extra segmental mechanism. So again, peripheral mechanism I said, segmental mechanism I said, and the last one is the extra segmental mechanism. And we have to revise over here that peripheral mechanism is useful when we are applying conventional TENS, and it is even using segmental mechanism. When we are using the TENS, it is using extra segmental mechanism also, and when we are using burst TENS, it is using peripheral, segmental as well as extra segmental, all the three, because it is having variation in the pulses or burst in the pulses, which might even lead to twitching in the muscle also, right? So this is the main mechanism, three main mechanisms of action of TENS. You have to know this if you are actually going to use TENS for pain killing effect. You must be aware of these mechanisms, so that again it will help you in clinical decision making on making a decision of where and what type of current you are going to use for treating the patient and how you are going to use this current, right? So I hope you understood these mechanisms. Please keep in mind that these are very important for you for the point of view of your practical exams also, for the point of view of your MCQs also, for the point of view of your long answer questions also, and even for your information also, right? So these are the basic mechanisms of working of TENS, right?